Hey everybody, I hope you are all doing well. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going over a topic that we see a lot in here, and it's this indescript knee pain. And of course, I always base my Facebook Live topics off of questions I've answered all day. So this is how most people come into our office with knee pain. I don't know what happened. It just started hurting. I was either running or walking down the steps, or I go to get up from my desk and my knee hurts. I want to make it perfectly clear that very, very rarely do we get knee pain patients that go, yes, I was running, I tripped and I fell, and that's how I hurt my knee. Because that's not how most knee pain happens. Most knee pain happens of, oh, I'm going down the steps and my knee's really bothering me. Or I'm running and I'm getting knee pain. I go to stand up from my desk and my knee hurts. There was no trauma, there was no accident, there was nothing that happened that you can think of that why your knee would hurt, but all of a sudden it does. And now you're like, do you ignore it? What do you do? How do you fix it? It's a very, very, very common problem. Most people just pop the Advil and hope it goes away. A lot of times this will work for a little bit. Eventually it won't work. And then let me make it perfectly clear that popping Advil doesn't fix anything. So when you have pain, if you don't know where your pain came from and all you're doing is taking anti-inflammatories, you're going to cause yourself more pain in the long run. So I know a lot of you are like, I don't care, it stops hurting for the minute. When you're crying in my office because you can't move, that's the anti-inflammatory kicking in that caused you more pain. So unless you fall and you trip and you sprain your ankle or you sprain your knee, you know exactly how you did, and those anti-inflammatories are going to help just take a little bit of that edge off. They are not solving any problem. So if you have knee pain and you don't know where it came from, it is not going to go away with just some anti-inflammatories. That may take the edge off, that may kill the pain for a little bit. You didn't solve anything. And the number one reason that people wind up with knee pain that becomes debilitating, where they can't walk, they can't run, they have to go up steps sideways, or they have to go up steps one at a time, or they have to go up steps with the height of their head, is because they didn't deal with it when it first started. They ignored it. Most people ignore knee pain because they chalk it up to arthritis. Let me tell you something, everyone over the age of 18 that has an x-ray or an MRI is going to show some type of arthritis in your knee. It is not uncommon. Same with your back, anywhere else. You start to degenerate as you get older. As much as I want to find the fountain of youth, I haven't yet, so it's going to happen. So a lot of people chalk the knee pain up to arthritis. It's not going to go away. I'm going to ignore it because all I know is that I'm going to have to get a knee replacement. I can't tell you how many times I've actually sent somebody to get a knee replacement. Maybe once, maybe. And they literally came here for like aquatic therapy week before they went to get a knee replacement. Very rarely is that the fix. But most people are so afraid to go to therapy to get it diagnosed because they're like, oh, I know it's arthritis and I need my knee replaced. And in doing that and ignoring it, you wind up actually causing yourself to have a knee replacement. Where had you treated the reason for the pain, you may not have had to get that knee replaced. Not all knee pain needs a knee replacement. It is not something that's very popular. Even injections, it's not something that's very popular. So if you are someone that is avoiding dealing with knee pain because you think, oh, it's just arthritis, my mom has a knee replacement, I'm going to get a knee replacement, it is not hereditary. Knee replacements are not given out in line. Okay? So don't ignore knee pain because you are afraid that it is something that is, one, not going to be fixed, or two, going to be fixed with a very expensive and painful surgery. That's not the case. Most knee pain can be fixed within a few sessions of physical therapy, depending on how long it's been going on. Now, if it's been going on for a while, it's going to take a little bit longer. But it's important to understand the longer you ignore knee pain, the worse it's going to get. So make sure that you address it right when it happens. And again, it's going to be something that gradually builds up. It may be uncomfortable at first. Maybe you're out running and you feel it at mile 1, but by mile 1.2 it goes away. But now all of a sudden it stays beyond mile 1 and it stays beyond mile 2. Or maybe you could go down the steps normally, but now you have to do it one leg at a time. You start to notice your function decrease. So you start to notice things changing. changing. Now you can't kneel down anymore because your knee is starting to hurt. Now you can't bend down anymore because of your knee pain. So notice those changes. That's when it is important to address what is going on. That is when it's important to figure out why the pain is coming in. So how to fix it, what is it coming from? Well, here's the trick about the knee. And here's something that I get very angry about my own profession, because a lot of times knee pain is done injustice, because you go in to therapy and they give you a little bit of these and maybe some hamstring curls and they think it solves everything. Most knee pain has nothing to do with what's occurring at the knee. Most knee pain has to do with what's occurring at the hip and the ankle and the foot. So what happens is all these muscles that attach at the knee come up and attach at the hip, go down and attach at the foot. So there's various muscles that are working, that are also working at the hip, that are also working at the foot. So it's impossible to diagnose knee pain without looking at your hip and your foot. And if you have had it diagnosed, they're missing something. So you really want to be careful, even an x-ray, because your x-ray is going to show arthritis, your x-ray is going to show degeneration. But you've got to figure out why you actually have the knee pain. Is it hip weakness? Is your foot flat? Is your foot too high arched? Do you have weakness somewhere? It is really important to understand all the avenues that are causing that knee pain. And generally it's never just one. I get a lot of pictures and a lot of questions and a lot of things about, oh, it hurts out here. It's IT band tendonitis. But why do you have IT band tendonitis? Why are you overusing that muscle? A diagnosis of a tendonitis is just an overuse of a muscle. Now you got to figure out why. Why are you overusing that muscle? Why? Do you have any idea? Do you understand that when you walk, you're using your IT band more? No. No, because there's inherent muscle patterns that you are using that are causing you to use that IT band more. What muscles are weak? That's what you have to figure out. And it's not well, your adductors are weak, it's your quads are weak, so that's why you're using it more. Everybody's different. So there could be a weakness of the glutes, the hamstrings, and things like that are causing you to overuse that IT band. And I just use IT band tendonitis because it's one of the more popular diagnoses at the knee, but then nobody takes the time to actually figure out why it's happening. And it's important to figure out the why. Anytime you have an overuse injury, arm, leg, whatever, why do you have tendonitis? Why are you overusing that muscle? How is that muscle how are those muscle patterns not working correctly? You've got to fix all that. That's how it works. So when you say fix knee pain, and when I get asked, how do I fix this knee pain? It's not as simple as just saying, okay, oh, you have pain at your knee, here's what it is. And it frustrates me a lot on social media when I see, oh, I have knee pain when I'm running. Oh, and then like 50 people are like, do this stretch, and then do this stretch, and then do this stretch. I do this for a living. I do this for the Olympic athletes. I can't diagnose it on Facebook. So kudos to everybody else that can, but if you're getting information like that, I mean, you can certainly try it, but you're not fixing your problem. They're fixing what they had that worked for them. So just be aware that when you look up knee pain, and this person says do this stretch, and this person says do this stretch, it may not work for you. It may not apply for you, because you have to figure out exactly what is going on at your own knee. So that is the number one thing on how you fix knee pain, is you have to figure out what's going on. It is not very easy to say, okay, here's a couple things, that'll definitely fix it. I'm going to show you a few exercises that can be universally used that aren't going to hurt you, but it is important that you address why you have knee pain. Find the cause, and then you can determine the appropriate course of action. Just don't get steroid injections, and don't take Advil thinking it's all going to go away. And don't listen to your friend who had the exact same knee pain, because they didn't. All right, they didn't have the exact same knee pain. I see 50 knee pain cases, and probably maybe 2 of them maybe kind of are the same. But everybody has different muscle structures. Everybody has different makeups. Everybody has different bone structures. So you have to understand all that and look how all that plays together. So that's my soapbox for knee pain, but you've got to find out where it's coming from. It's really important, because you've got the hip and you've got the foot that also contribute to that knee, and actually are the drivers at that knee. So it's really important to understand what those are. So when you're talking about knee pain, one of the first things you can do is you can do a solid foam rolling workout. You can do a solid foam roll of the IT band, of the glutes, and of the quads. Now on our YouTube channel, you will find all of these different rollers, all of these different ways to roll those muscles out. But it's really important that when you start to feel knee pain, that you start working the muscles out that are up here and that are down here. Now, you may not be able to tolerate foam rolling. This is one of the things that I hear people say, I can't tolerate foam rolling, so I'm not going to do it. Do not stop foam rolling, okay? If you have a bumpy one, get a flat one, all right? Don't put as much weight on the limb. But if you have pain when you're foam rolling to the point where you want to stop, you should actually be doing it more. And if you cannot tolerate it, you really need to be seeking medical help, okay? It is not something that you should ignore. If you can't tolerate foam rolling, there is a major problem going on, and one that's going to debilitate you very, very soon. Maybe not tomorrow, but down the line, you're not going to be able to walk or run or do much without severe, severe pain. So foam rolling, this part, this part, this part, and this all down here is where you need to start. Knee sleeves, don't use them. They're really not. I mean, they give your knee a little hug. If you feel better, fine. They're not going to solve anything. So that's just a little quick disclaimer on, I know I get asked about braces and sleeves all the time. They're not going to do anything. It might get a little bit rid of a little bit of swelling, but don't use them thinking that it's going to help your knee. I'm going to show you a quick hamstring stretch and a gastroc stretch to show you a couple stretches you can do. So for the gastroc stretch, you can either find a step, you can find a wall. I happen to have a shuttle balance, and you're just going to put your foot up against it, keep your knee straight, and then you're just going to walk up to the wall or whatever apparatus it is. You're going to feel a stretch in the back of your knee right through here. All right, that's totally normal. If you feel it lower, if you feel it higher, that's okay too. Just stop when you feel a stretch. Don't push through because you're like, oh, I feel a stretch right in the belly of the muscle. Depending on where it's tight, you may feel it above or below. You want to do that about 30 seconds, 6 times. This is something you can do like sitting at your desk, you know, when you can stand up, or standing at your desk. And you can then take that right into a hamstring stretch. So if you got your foot propped up, and you may not be able to tolerate your foot propped up as high if you got really tight hamstrings, so you might want to drop it a little bit, but still have those toes elevated. Turn your hips toward you, and then you're just going to keep your back straight and then lean forward, and you're going to feel a stretch in the back of your hamstring. If you start to do this, you're not going to feel anything. There will be no stretch. It is really important that you keep your back straight, your hips pointed forward, and that you lean forward. That's going to get your hamstring. So between the gastroc stretch and the hamstring stretch, you have stretched the back of that leg. But if you have trigger points, if you have knots, if you have those things that when you foam roll, you go ouch, and you try and stretch, it's going to be ineffective. You need to make sure that you have gotten those knots out with the foam rolling before you stretch. Otherwise, you're just tugging on a string that's tied tight. So the final thing I'm going to show you how to do is one thing that universally everyone has that's generally weak, and that's your glute medius. Glute medius contributes to foot pain, it contributes to ankle pain, it contributes to knee pain. So this is a quick exercise to do. You want to start by standing on one leg. You can use a counter for balance if you want to, preferably not. But you want to start by, this leg is going to stay still. It's not going to bend. This is the biggest mistake people make with this exercise, is they want to go up and down with their knee. The knee does not move. You don't want to lock it out straight. You just want to have kind of a soft bend in it, and it does not move from there. And then all you're going to do is you're going to hike your hip up. So your hip drops down, and then it drops up. If you want to figure out how to do this motion, just stand with feet together, and then hike your hip up so your one leg comes off. This is a really hard motion for people to get. I get this, I get this, I get this, okay? Just stand there and lift your foot off the ground. It's a small movement, and you're going to feel it on the leg that's standing, not the leg that's lifted. After a couple reps, you may feel it in the leg that's lifted, but this leg, probably right away or right after 15 reps, is going to start burning, and that's okay. That means it needs to be stronger. So again, you're just here and you're hiking your hip up, and then you're switching. You want to do about 3 sets of 20 of these on each side. Nothing is moving except your hip. So if you find yourself doing this, or you find your knee moving, or you've got every body part moving, you're not doing it correctly. You will feel it right in that glute area if you do it correctly. And then once you get good at it, you can actually start dropping your hip down and up. But this is where you start, just lifting that foot off the ground. But with any knee pain, it's super important you figure out exactly what is causing the knee pain and where it's coming from. If you are suffering from knee pain and want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.